Welcome again to Save Your Money, Save Your Teeth. It's the go-to podcast where curiosity meets dentistry. It is straight from the experts. The expert joining us is Dr. Clifford Yudelman from Opti Smile. My name's Ian, and we are here ready to take a deep dive into the world of dental care. It's from a consumer's perspective. So whether you're looking to brighten your smile or just protect your wallet, we've got you covered with practical advice and the latest insights. So do stick around as we uncover the secrets to maintaining both your dental health and also your finances. Once again, a big welcome to you, Dr. Clifford Yudelman. Hope you're well.
Thanks. Yes, I'm great. Thanks for having me on, and looking forward to today's episode. Thank you.
So it's the second one in the dental implant series, and the question I want to start with, Doc, is what are the different types of dental implant treatments available today?
So basically, there's single tooth implants, multiple teeth implants, full mouth reconstructions, implant-supported dentures, and zygomatic implants. I'll explain very briefly what each of these are, because we'll get into that further with some further questions later. But basically, single tooth is just that. You replace individual missing teeth with one implant per tooth. If there's multiple teeth missing, we often will do a bridge. So if you've got anywhere from 3 or 4 teeth missing, you may only need one implant at one end and another implant at the other end. Implants are very strong, so you can actually put 3 or 4 teeth on 2 implants. And then full mouth reconstruction, there's something that's known as all on 4 or all on 6. Sometimes we say all on X because it can be any number, it can be 5. Basically, that's for replacing all the teeth in a single arch, meaning on the upper or the lower. And then there's implant-supported dentures, which are removable dentures that clip onto the implants for added stability. That's called an overdenture. And zygomatic implants, to be honest, in South Africa, I haven't really seen that, but it is done overseas. And that's patients who have no bone left on the upper, and it's a very long implant that's placed all the way up into the back of your jawbone. As I say, it's not something that I'm that familiar with, but it just so we've got a full answer that does exist.
Okay, and how does a single tooth implant procedure differ from a multiple implants or full mouth reconstructions?
Yeah, so the procedures are similar, but not exactly the same. So a single tooth implant is generally obviously less invasive and a very short treatment time. If, for instance, you've got a missing tooth on the lower molar, which is one of the most common to be lost because people get a root canal and they don't get a onlay or a crown on it, and they split it and they lose it. If the bone is all healed, you do the 3D scans that we mentioned before and the 3D X-ray, and you blend them together. You do a guide, which is 3D printed, and it's got a little hole that you use to guide the implant placement, and the implants are placed in the exact right spot, and then the crown is put on top of that. Multiple implants can also be done guided, and that uses, like we mentioned earlier, 2 or more implants to support a bridge. So sometimes you can put 2 or 3 implants and there can be 6 teeth on it. It's all designed ahead of time, all the way up to the full mouth. The complexity and the healing time, obviously, full mouth procedure will be more complex with longer healing time. There are cases where you get immediate full mouth, where a whole bunch of remaining teeth, or say someone's got 4 or 5 or 6 loose teeth that need to be extracted, but there's bone in between. They may get the teeth extracted and then implants placed into the good bone, and then it all has to get stitched up. It can be quite a big job. So someone like a prosthodontist or oral surgeon would do that. There are general dentists that can and may do that, but generally that goes into the realm of dental specialists. And then obviously cost increases with the number of implants and the complexity. So that's basically, the how they differ, those different procedures.
Okay, and doctor, can you explain what an implant-supported bridge is, and when will this be recommended?
So it reduces the need for an implant for every missing tooth. So in other words, if you've got, like, say, 6 missing upper front teeth, which is sometimes common, you can put 2 big implants in where the eye teeth are, and then do a 6-tooth bridge across there. Or if you're missing from your eye tooth on the bottom and there's no teeth behind, you can put an implant in behind the eye tooth and then one all the way at the back. And you could put some premolars and molars. You can put a whole bunch on there. If you're missing 2 lower front teeth, you may just get 1 lower implant that has 2 teeth on it. That's called a cantilever. And sometimes it's done in the front as well. So it's always custom planned. There's a number of different ways to do that. Yeah, and you get enhanced stability, and it preserves the jawbone compared to a traditional bridge, which is where you pull out a tooth and then the bone keeps receding afterwards.
Okay, and what factors influence the choice between single, multiple, or full mouth dental implants for a patient?
Yeah, so the obvious answer is the number of missing teeth, the bone density and the quality of the bone. Sometimes it affects ability to place implants and necessitates grafting, the overall oral health. So if someone's got a lot of gum disease and it's not very easily treated, that might be a case where all of the remaining teeth are removed and implants placed. So you're not mixing and matching regular teeth with implants. That way, all of the infection goes away. The patient budget considerations, the financial factors, and the patient preference. If somebody wants something that's fixed versus removable. So, for instance, if you're missing all your lower teeth, you could get 2 implants with little clips on them and get a denture that clips on there. Or you could get 4 implants with a bar and get a denture that clips onto that metal bar, all the way up to maybe 6 implants, and then get a custom big bridge, basically all on 6. That's basically all your teeth, and that gets screwed on permanently. And the cost and the complexity goes up dramatically with each of those. That last one that I mentioned is very popular for the people that can afford it.
Okay, and now that you're talking about affording it, let's talk about costs. How do the costs vary among the different dental implant options?
So obviously the single tooth implant where there's bone that doesn't require bone grafting, that's the least expensive option. Sometimes it can be even the same as a bridge. I don't want to mention prices because implant prices do vary very greatly. And from dentist to dentist, depending on the brand of implant they use and their experience and whether it's guided or unguided. And there's a lot of other variabilities with the costs on implants, such as the quality of the lab that they're using and so on. In general, you get what you pay for, unless the dentist has just got very, very high fees for no apparent reason. Multiple implants and bridges is very cost effective for replacing several teeth. But obviously it costs more to replace 3 or 4 teeth with 2 implants than it does to do a single implant. And then the full mouth reconstruction, that's can be very expensive in the couple of $100,000. Long-term value, sometimes higher initial cost is offset because the durability and the reduced future expenses. And then there's also the medical aid cover. Different medical aids might cover certain things differently. Some people get implants placed in hospital because they get hospital cover for implants. It depends on the medical aid.
And now we get to after the procedure. What is a typical healing time for each type of implant procedure, doctor?
So single implants and multiple implants around about the same. We mentioned between 3 and 6 months. You can sometimes get immediate placement where you get an implant placed and the bone is very solid and you can get a temporary crown screwed onto that right away. or you might just have what's called a healing cap, a little screw that sticks through the gum. Used to do a lot of two-phase surgery where the implant is completely buried and submerged. The gum is stitched up over the implant, and then 3 months or 6 months later, there's another whole surgery. That's not that common these days. Full mouth reconstruction, that can take 4 to 8 months. A lot of the time with the full mouth, you can get immediate load because you're joining a whole bunch of implants together. You got 6 or so that are all getting bridged together, and then that makes it quite resilient to any kind of movement as opposed to a single one. If there's bone grafting, that extends the treatment, can be quite dramatic. Sometimes patients can have several surgeries over the course of a year before they can actually get their tooth. And it varies from patient to patient depending on their age and their health.
Do you also find that patients lose a lot of weight during this process, during the recovery process?
No, not at all. Not with implants. Yeah, it's because it heals very. Like when we say healing, that's just waiting for the bone to heal around the implant. Even if you get extensive, you get a patient that gets all their teeth out and they get implants placed, and if they get an immediate placement of a temporary bridge, they can usually eat better on day 2 or day 3 than they were ever able to eat. Now I think people put on weight. Yeah, it's a good question.
Okay.
Yeah.
And what else can patients expect during this recovery process?
So like I said, just mild swelling. If you're getting very extensive up and lower, you're getting a lot of teeth pulled out and you're getting 12 implants, you're obviously going to be a bit beat up after that. It's not that common in South Africa because it's a very expensive treatment. And often the patients where their teeth have gotten to that point, usually it's because they could not afford to look after the teeth in the first place. It's not like if you're in the UK, maybe you got the national health and there's just been poor care, but you get coverage for some of this stuff. And, it's obviously a lot more common, or in other countries, depends on the socioeconomic factors and that. But generally, for the single implants, very mild swelling, if anything, hardly any discomfort, some panados. We do sometimes tell people to eat softer foods. You avoid chips and crisps and very crunchy things. You got to keep it clean. We give you mouthwash and a soft toothbrush. And then there's follow-up appointments, and people can usually get back to their normal activities within a few days.
That's fantastic. And I know we touched on it briefly earlier, but how does the condition of a patient's jawbone affect their implant options?
So you need adequate bone density, which will mean that when we screw in the implant, there's good stability and success. If there's bone loss, we mentioned bone grafting. So there's different ways that bone grafting can be done. Sometimes there's bone grafting where some bone will be taken from the back of your jaw and transplanted to the front of your jaw. Sometimes it means bone grafting using what they call bottle bone. It's a bottle with bone chips, either synthetic or at one point it was freeze-dried cow bone, but then now they've got other ways of doing it. There's a number, as many surgeons or implant dentists as there are, so there's different ways of doing bone grafts. Then in the upper, if a patient's missing an upper tooth, that's quite common for the sinus to be too low down and that there's not enough space to put an implant. So then there's different types of sinus lifts where the sinus can be moved out of the way, all the way from a closed sinus lift using a special technique called densar, where as the implant is placed, that it pushes the bone and pushes the sinus up out of the way, versus a full-blown where you go and they open up the side of the sinus and they start packing in bone. It's quite a big surgery. Obviously, there'll be a fair bit of swelling after that. That's usually done with a periodontist or an oral surgeon. And if it was me, I would be sedated or asleep. I wouldn't have that while I was awake yet. A single lower implant. The drilling to put the implant in is quicker than getting a filling. It's not a huge big deal generally. there are alternative implants that can be used if you don't have much bone. We mentioned zygomatic, but it's not that common. And we do bone special diagnostic imaging using CBCTs. You got to know where the bone is, the quality of the bone. You don't just go and, drill a hole in someone's jaw and stick a screw in there. It's quite a advanced procedure with the dentists that do this, attend conferences and do lots of courses. Our dentists attend something called ITI, International Team for Implantology, and our prosthodontist actually has been very well known. He's been teaching implant surgery and implants for many, many years in South Africa.
And doctor, any advancements that you've noticed in implant dentistry that have actually improved the recovery times or the outcomes?
Oh, yeah. So we mentioned guided surgery. So before 3D scanners and 3D x-rays, it was a lot more, I wouldn't say hit and miss, but the dentist had to cut away, peel the gum back and really get a good look at the bone and try to figure things out and take lots of x-rays. And it was very much an art form, whereas now with guided surgery, it's very precise. The dentist it's like Lego, you put the one, then the next, and the next, and it's fairly straightforward if you've had the training. This immediate loading, which is where we can place temporary crowns onto the teeth on the same day, or in the case of a full mouth, we can sometimes screw in an entire whole new bridge or denture. There's been a lot of advances in the design of the implants and also the purity of the titanium and so on. Generally, it's just very, very pure titanium. That's what almost all the good implants are made from. There's nothing else. No, they've got different threads, different ways that the thread on the screw is designed or the way the crown or the screw fits in the top, but they're all more or less the same. And then minimally invasive techniques, which is your guided techniques. There is something that we use here called PRP, or platelet-rich plasma. That's where we use the patient's own blood to accelerate healing. We have a special centrifuge that spins the blood for 15 minutes.
Wow.
And then you pull out with a syringe, it's like a yellow clot, and that's got all your own platelets. And then that can be mixed with bottle bone or used to help to form a clot around, and it acts as a scaffold for the bone to grow in around the implant, and you get beautiful healing. It's the same thing they use for those vampire facials or to inject into joints that are giving problems.
Okay, wow, that's fascinating. And then finally, doctor, what advice would you give to someone, a listener perhaps, who is unsure about which dental implant option is actually right for them?
So I'm going to say see a specialist, but these days there's a lot of dentists that are highly trained in dental implants, so you don't have to always see an oral surgeon. I mean, in fact, sometimes we get patients who they go to an oral surgeon. The oral surgeon will put in a whole bunch of implants and say, go to your dentist now and get some crowns. And the planning always should be done by the dentist or the prosthodontist, the person that's going to be putting in the crowns. And they need to tell unless they're doing it themselves, they need to tell the periodontist or oral surgeon where the crowns need to be. It all needs to be planned in 3D and along with input from the laboratory technician. It's like a three-way planning. So you don't go to an oral surgeon or periodontist if you want an implant. You go to a dentist that is specialized in restoring the implants. And these days, a lot of those dentists, like what we have here, they'll also place the implants themselves, except if there's something complicated like big bone grafts or sinus lifts, then they work closely with a specialist of their choice. Ask questions, understand the pros and cons of each option, and think about your long-term goals, the durability, the function, the aesthetics, and then discuss different financing options and consider the long-term value, and then choose something that aligns with your lifestyle and your personal preferences. Don't settle for a loose denture if perhaps you have got some savings and you can improve the quality of your life by getting, even if it's just 2 implants on the bottom for your denture to clip on so it doesn't float around or fall out, all the way up to if you have a couple of 100K in the bank and you want to get all new teeth screwed in, that would also be an option.
Dr. Yudelman, thank you so much. Once again, very, very insightful. We appreciate it.
No, pleasure, and thanks for having me on. And I look forward to speaking to you next week. It will be our last one about implants. So.
Thank you so much. And also, here comes the disclaimer. Remember, while we strive to provide valuable insights with this podcast, you must always consult with your own dental professional for advice tailored to your personal health. But do remember to subscribe for more enlightening discussions. Join us again next week for more enlightening discussions here on Save Your Money, Save Your Teeth, as we continue to explore the fascinating intersection of dental health and also financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.